Kia ora, ko lu toko ingoa, my pronouns are they, them.
Kia ora, my name's Arlene and my pronouns are she, her.
We are both registered midwives providing pregnancy care to the rainbow community. I am a queer non-binary midwife. I'm also a postgraduate student and work in resource development and antenatal education centred on gender and sexual minorities.
And I am a queer midwife and yoga teacher providing LMC services within Tamaki Makaurau. So whilst I was working as a core midwife at the DHB, I was becoming increasingly despaired at the significant amount of homophobic and transphobic rhetoric I was hearing and listening to when rainbow parents were using the maternity services. So I did some research and sent out a survey, and this is some of the feedback that I received from those people who took part. Many felt disrespected, disregarded and afraid, and they had so much angst and uncertainty and have negative experiences within the health system that was actually a barrier to them considering having any more babies. Lots of people also felt that they needed to ask if it was okay for someone to be their midwife because they were gay, and many also said that it was nice if they didn't have to be the teacher in that relationship.
The other thing that I found in my consumer-facing research was that even though there's a support for fertility preservation, that a lot of trans people didn't know how they would access that fertility preservation and go on to have kids. And they kind of saw that parenting and having kids was kind of like the final frontier for them in terms of healthcare or being accepted as a transgender person. And it felt really, really inaccessible for a lot of trans people.
And overwhelmingly, most people said that yes, they would prefer to use a queer-friendly midwife and that a queer pregnancy service was definitely needed, which was really lovely. And 85% of people who already had children who answered my survey said that their midwife was actually queer friendly. But interestingly enough, 50% of those people with children still had some serious concerns about going forward and having any more pregnancies because it wasn't inclusive.
And I think there's also a difference between queer friendly and queer competent, which is what we're trying really hard to do.
Yeah. And, something that also someone said was that just because you're a lesbian doesn't mean that you're a good midwife, which is so true. So following on from that, in order to combat the negativity and this deep depression and despair that I felt within my soul for the rainbow community, I set up Empwr, which is a compassionate pregnancy service dedicated to the rainbow community, providing clinical care to anyone having a pregnancy. Lou and I have then joined forces and are providing a wraparound service for complementary therapies as well. Lou is a qualified acupuncturist and massage therapist, so we are able to offer a really holistic approach to having a baby.
One of the things that was really important to us, both separately and then together in our work, was representation, was that we weren't just regurgitating the information that was already super heteronormative or gendered. And so what we did is we took all the information, which at the moment is really in bits and pieces because of the way our DHB structure works. We gender neutralized the information, we illustrated the information and got people to do illustrations for us that portray gender diverse people, and we provide our clients with this really clear, cohesive information about their pregnancy journey that shows them represented in those resources.
Something that was also really important for me was offering my pregnancy clinics away from the usual maternity or health structures. So either that be in a GP surgery or mama maternity. People also fed back to me that having to see pictures of happy straight couples, particularly at infertility clinics, was really triggering for them and just felt like they weren't seen. Likewise, so for that reason, I run my clinic out of an apothecary because it's away from that really heteronormative space. Equally, I really wanted to make sure that I was being inclusive to polyamorous whānau, so there is multiple spaces to enter in your partner or co-parents' details. And we also always run through a language preference section right at the first meeting to discuss the common terms that we would normally use, things like breastfeeding, vulva, woman, mother, those sorts of things. And we discuss what terms would be most appropriate for people.
The other part of my work in this is to make care provider facing resources. And the easiest way that I found to do this is actually to use Instagram. We never want to gatekeep the space. Ideally, in our dream world, all care providers are competent at providing gender and sexually diverse people with pregnancy care. And so I give some basics on the how and the why of providing inclusive care. I teach my antenatal classes in a completely gender neutralized format. And then I also do a little bit of professional development, mostly with antenatal educators. And that gives us some space to explore not only the how and the practicalities of using inclusive language when we talk about pregnancy and birth, but also the why. And it helps kind of explore with them why this work matters and the theories that underpin that stuff around intersexual feminism and gender theories. When you work in birth and you work in pregnancy and parenting, this is one of the parts of healthcare that is deeply, deeply gendered. And so part of the question that we're constantly asking ourselves and we're constantly asking of our colleagues is, how do we untangle that cis sexism and heteronormativity from a profession that is so deeply rooted in that? So as I talked about, there's the professional development for childbirth educators that we're able to do. And ideally with some funding and some resourcing, we'll be able to extend this into that same continuing education for midwives and care providers. At the moment, it is a little bit inaccessible. Our governing bodies have been really slow to come to the table with gender inclusive care, and that means that there's not a lot out there that caters to care providers within maternity learning about gender inclusive care.
So something that we do is we are both quite active on our social media, that we are out, we talk about being queer midwives a lot and all the time, and we are also engaging with our other rainbow midwives and other rainbow allies and health professionals, and we're continually updating our database of queer friendly and queer competent health practitioners across the pregnancy spectrum for people to access.
And while a lot of this work is really gentle and lovely and it's calling people in, sometimes it does call for affirmative and group action. So our Rainbow Midwives Alliance on Facebook has allowed us to do things like write open letters and initiate campaigns when we feel that our governing bodies are causing immediate harm that needs to be stopped.
So this is some of the feedback that we've received since setting up Empwr, and it is really, really affirmative. And one of the things that I didn't anticipate in starting this work was how much and how significant the queer joy would be for me personally. It was always centered for the pregnant person and the person giving birth in that new whānau, but something that I didn't realize was that I also seem really, really, really seen and valid as a queer person going through this world, which is really, really wonderful.
So going forward with time, with funding, with resources, we want to continue to provide a wraparound service for parents from start to finish. And then we also want to be able to continue to welcome other care providers into this space, extend that resource bank, extend that database of people who are competent in this space.
So if you would like to contact us, please feel free. We are always so happy and really love connecting with other people working in this space. And yeah, if you have any questions, please let us know.
Thank you so much.
Thank you.
Go forth, have babies.
Kia ora koutou katoa. We're really delighted to present to you our paper for the symposium, Trans, Non-Binary and Takatapui Inclusive Perinatal Care in Aotearoa, Growing Our Own Evidence. I'm George Parker, I'm a non-binary person, my pronouns are they, them. This is Suzanne Miller, my friend and colleague and co-researcher on this study that we're going to be talking to you about today. Just to acknowledge the organisations that stand behind us for today's presentation, which you can see on the slides there, and also to acknowledge Huriana Pōpiki Te Aho, who is our amazing artist who's done the image for this presentation. Quick overview of what we're going to be covering. We're going to be talking a little bit about the study context, briefly describe who makes up our research team, our aims and objectives in the study, the two distinct phases of the study, and study outcomes and next steps. Very quickly going to run you through some key aspects of the study context, acknowledging that you'll have a much better insight on the context that sits around the study we're going to be talking to you today from the panel on fertility preservation and perinatal care. That's also part of this session this afternoon. But very quickly, just to kind of say that what we're talking about is an 18-month study that has just started on the 1st of September, that has been funded by the Health Research Council of Aotearoa, New Zealand. So what we're really describing today is the kind of situating the study, why we're doing it, how we're doing it, what we hope to achieve out of it, and then we'll really look forward to the opportunity to come back at a later stage and tell you what we found out and then look at implementation. So the study responds to a global movement underway that is calling and working towards gender inclusion in perinatal care being the care provided to people who are pregnant during birth and in the early weeks after they've had their babies. Those perinatal care has traditionally been developed on the assumption that the people who are pregnant and giving birth are women identified, and we see how those assumptions around the gender of the pregnant and birth giving person are woven right through all aspects of care and the general culture of perinatal care. However, that isn't the case, and we know that globally gender diverse people are preserving their fertility as they go through gender affirming healthcare and are seeking to be pregnant and give birth to their babies. And so it's a strong call underway to ensure perinatal care has been designed, developed, delivered, evaluated with the inclusion of trans, non-binary and other gender diverse people in mind. We've seen a big step forward in regards to that in the Brighton and Sussex University Hospitals NHS Trust Gender Inclusion Project that's directly looked at the call for gender inclusion in their perinatal care services, where there's a large trans and gender diverse population, and the guidelines that have come out of that project are considered something of a kind of global best standard for gender inclusion in perinatal care at present. They've come out just a few months back, so are a very new and exciting development. And we've also seen international research collaboration underway called the Trans Pregnancy Project, which is looking to develop a really strong research evidence base on the perinatal care, pregnancy and birth experiences of trans and gender diverse people. We currently have no literature that describes or responds to the experience of trans, non-binary and takatapui people being pregnant and giving birth in Aotearoa. And that's definitely an omission because we have quite a unique perinatal care model here in Aotearoa. And so we absolutely need to understand the process of gender inclusion in response to our unique model. What we do know from existing literature internationally is that the care provided to trans, non-binary and other gender diverse people who in the course of their pregnancy and birth and in the early weeks postnatally is often inadequate and unsafe, and that results from the dynamics both of transphobia, overt stigma and discrimination, along with all of those unexamined norms associated with a kind of cis normativity and a cisgenderism in perinatal care. And we also know that those experiences of transphobia and cis normativity are compounded for people who are also marginalised along other axes, say, of race and class. And finally, just to note that there's a lot of work underway in Aotearoa outside of a research context to progress gender inclusion, but also lots of challenges. And I won't speak to those now because they will have been covered off in our panel presentation a little earlier. So I'll pass back to Suzanne. Thank you.
Kia ora, George. I just would really like to briefly introduce you to the members of our research team, most of whom won't actually need any introduction to you at all. So from the top left, we have Alex Kerr, and Alex is our research assistant extraordinaire, and we see them as our kaitiaki for our project, who holds us all together and keeps us on track, doing an amazing job. Elizabeth Kirikiri is the founder and chair of the Te Whanawhana Trust. Sally Baddock is the Director of Research in the School of Midwifery at Te Kura-Matatini ki Otago, so that's Otago Polytechnic. Jamie Veal is a Senior Lecturer in Psychology at Te Whare Wānanga o Waikato at Waikato University, and also the Director of the Transgender Health Research Lab. Kia ora, I'm Suzanne Miller, and I'm a midwife and also the Postgraduate Program Lead in the School of Midwifery at Otago Polytechnic. Scout Barbara Evans is a Takatapui parent, and they're a lived experience advisor to our project. And of course, George is a lecturer in health service delivery at Te Here Waka, the Victoria University of Wellington. So that's us.
Kia ora, thanks Suze, and we really love our research whānau, hey? Amazing people. Very briefly going to run you through our research aims and objectives, acknowledging that you know, some of the context we provided to you really speaks to those. But in essence, we are looking to determine in relation to the specific perinatal care context in Aotearoa and our specific communities, what constitutes quality, safe and culturally responsive perinatal care, and to identify the education needs of our perinatal care workforce in Aotearoa to support equitable access and outcomes for our communities. So kind of sitting underneath that are three more specific objectives, and I'm only really just going to list those off because actually we're going to describe those in a little bit more detail. But in essence, we are looking to both understand and capture experience, the perinatal care experience of trans, non-binary, Takatapui and other gender diverse people, and then to engage with our perinatal care workforce to understand their information support needs, how and in what ways they understand and are able already to progress the challenge of gender inclusion, and in what ways the workforce needs extra resourcing to do that. And finally, to bring them together in a set of recommendations and some strategizing for the Ministry of Health and for the perinatal sector to really a much more kind of integrated and intentional way progress gender inclusion for the sector. So I think, does that capture it?
I think so.
Yeah. Moving on. So that's me again. So as I said, we're both interested in the experience of trans, non-binary, Takatapui and other gender diverse pregnant and birthing people. So that is what constitutes phase one of the study. It's a qualitative phase of the study. So we will be doing interviews either online or in person with ideally around 15 to 20 trans, non-binary, Takatapui people who are either currently pregnant, were pregnant, and that includes people who, for example, may have experienced a pregnancy loss but would still like to talk to us about their experience of care, and or who have given birth to a baby in the past 3 years, approximately 3 years. Participants will be recruited through our communities, through our community's social media networks, and through snowballing. We hope that people will pass on to other people, as we're so good at doing in our communities. I don't really need to go into the inclusion criteria other than to say that although it says that with I lost my thought at the end of the day, that whilst we will ask participants to be able to read and converse in English, there will be actually the option to be interviewed by a Takatapui researcher for Takatapui participants, and further than that, to be interviewed by someone who is fluent in Te Reo, if that's a preference. And all interview data will be transcribed and analysed thematically, and we'll pull out the core threads of those interviews, and that will help us inform phase 2, which Suzanne's going to tell you about.
Kia ora, George. So as George has identified, phase 2 of the study will involve a national survey of perinatal service providers, specifically midwives and obstetricians, to seek their views on the need for and key elements of gender inclusive perinatal care and the education and support needs of this workforce. Perinatal care in Aotearoa is delivered in a context that's quite unique when we compare it to international service delivery models. Here, over 90% of pregnant people register with a lead maternity carer who's a midwife, with the remaining people booking with hospital-based teams of midwives or perhaps a private obstetrician. Very few GPs currently offer perinatal care. So the vast majority of pregnant people work with one known midwife and their backup in a continuity of care context throughout pregnancy, birth, and the 6-week postnatal period. This person is responsible for coordinating the pregnant person's care, including making referrals as necessary to other providers. There's a growing group of midwives and obstetricians who are motivated to provide gender inclusive care to people within this community, and they're well equipped to do so. But until pretty recently, the education of health professionals has been a bit inconsistent or even absent, and our survey will hopefully provide an opportunity to assess the workforce preparedness and education needs in this space. International literature does confirm that midwives can feel clinically challenged by and ill-prepared for working with gender diverse pregnant people, but they are motivated to provide really high quality care and desirous of professional support to do so. But the culture of heteronormativity and cisnormativity that pervades perinatal care has been identified in a systematic review as being the main cause of inadequate care. So our survey will be developed following the analysis of the phase 1 interview data so that our reflections on the experience of participants can inform the questions that we'll ask. We'll also incorporate some questions from validated tools that have been used to assess practitioner knowledge, attitudes and preparedness, and also questions that specifically include perspectives from a Te Ao Māori world. It'll be great for us to be able to move to a position where respectful evidence-based care for gender diverse people during the perinatal period will no longer be seen as a specialised clinical challenge, but rather a fundamental part of regular care for every healthcare provider. Our survey may provide us with the evidence to support this vision. So please be alert to the arrival of information about phase 2 of our study landing in your inbox and help us out where you can.
Brilliant. Kia ora. Well, to summarize, to kind of conclude, really just to kind of look back to what we've already said around that it's early days in the study. We don't yet have data, let alone findings, but what we will be working towards is some very tangible outputs. We're looking to produce a final report with a set of recommendations that will be presented back to the Ministry of Health. That's one of the requirements of our funding, and also a very important goal for us, and we'll also produce summary sheets of research findings for specific parts of the perinatal care sector, say for example maternal mental health or other aspects of care that present specific findings and recommendations for those different parts of the service. And finally, we'll be developing some strategy around integrating the findings of the study and those principles of gender inclusion for perinatal care into pre and post registration perinatal health professional education programs, including midwifery and medicine. So that's us. Thank you so much for your time. We really hope that we've left some time for questions, and really appreciate your engagement. Kia ora.
Ka kite anō.